So how about for people without von Willebrands, just in
Correct.
general, what is the bleeding risk for IVF procedures?
So for people, normal patients, very minimal,
Okay.
very, very minimal. If you have a normal CBC and a normal PT-PTT, it's very rare that you have a bleeding problem. Knock on wood, I've never had any, severe hemorrhage of any of that sort. But in that, but I've also seen patients who were aspirated and maybe the surgeon hit a vein,
Hmm.
right? So you have to be very familiar with what the anatomy looks like, on the ultrasound when you're doing your egg retrieval. So it's very simple. Don't hit a blood vessel.
Yeah. Now, do people have to hold anticoagulation or antiplatelet therapy
Absolutely.
before they go through a
Yes,
procedure?
absolutely. So some patients may be on Lovenox,
Okay.
right? Because they have a clotting problem. So we usually, in that regard, I like to work with their hematologist and I like to get their suggestions. So the Lovenox, it's a blood thinner,
Yeah.
has to be stopped before retrieval, right? And they tell us exactly how many hours, days they want it stopped and how soon after can it be resumed. So if you're on a blood thinner, we need to work with your hematologist to determine when to stop it. You cannot be on a blood thinner when you're about to go through such a procedure.